Here's a question I want you to sit with for a second. When your doctor last checked your blood sugar, and they probably have more than once, did they also check whether your pancreas has enough zinc? Not your A1C, not your fasting glucose, not your post-meal numbers. Zinc, the mineral that your body uses as a structural building block to physically package, store, and release insulin molecules. The mineral that your beta cells, your insulin-producing cells, concentrate at levels that researchers at Stanford have documented as up to 1,000 times greater than surrounding tissue cells, because they cannot do their job without it. Here's what the research quietly confirms. Zinc deficiency is consistently found in between 40 and 60% of people diagnosed with type 2 diabetes, not a fringe minority, nearly half, and in some high-risk populations, more. And in a standard diabetes appointment, most doctors will run every glucose test imaginable and never once order a simple zinc panel. Now here's why that matters for what I'm about to show you. There is a seed, one specific seed, one that costs under $6 per pound at any grocery store, that delivers more bioavailable zinc per tablespoon than almost any other plant food that exists. And that same seed contains a compound that peer-reviewed research has linked directly to what scientists call beta cell differentiation, the process by which your body actually grows new insulin-producing cells from reserves that have been sitting dormant, waiting for the right signal. By the end of this video, I'm going to give you the exact seed, the exact dose, the exact preparation method, and 3 additional seeds that each target a completely different piece of the blood sugar puzzle. Together, they form a morning protocol built on clinical evidence that most people managing type 2 diabetes have never heard. Stay with me. This is worth your full attention. My name is Dr. Franklin. I've spent years in preventive medicine working specifically with older adults navigating metabolic conditions, prediabetes, type 2 diabetes, metabolic syndrome, and the complications that follow when those conditions go unaddressed at the root level. And I want to be honest with you about something early in this video. For most of my career, I was trained to think about type 2 diabetes the way most doctors still think about it, as a progression to be managed, not a biology to be corrected. Blood sugar rises, medication is added, medication is adjusted, complications eventually show up. That was the template. But over the last decade, the research has shifted, quietly, significantly, and in a direction that most mainstream diabetes education has been slow to follow. One of the most important findings in that shift is this. Pancreatic beta cells, the cells your body uses to produce insulin, are not simply counting down to 0 with no way to reverse the clock. Under the right biochemical conditions, they can be supported. They can be protected. In early and moderate stage type 2 diabetes, the pathways for regeneration and recovery are genuinely accessible, and specific compounds and everyday seeds sit right at the center of that research. That's what today's video is about, not a magic shortcut. Real biology, real studies, real protocol. Now, before I go any further, drop a comment right now and tell me, has your doctor ever checked your zinc or magnesium levels? Just say never checked or yes, they did. I read every single comment, and your answer will tell me exactly how common this gap really is. Let me give you a different way to think about what's happening in your pancreas, one that I've found resonates particularly well. Imagine your pancreas as a raised garden bed, and your beta cells are the plants in that garden. When you're young and metabolically healthy, the soil is deep, rich, and well mineralized. The plants grow strong, they produce abundantly, and when an older plant naturally dies off, seeds already in the soil germinate to replace it. The garden is self-sustaining. Now imagine what happens to that same garden after 30 or 40 years of neglect. The plants are still growing because they're resilient, but they've been slowly depleting the soil of the minerals they depend on. Zinc, magnesium, manganese. The critical micronutrients that power not just plant growth, but the repair cycle that keeps the garden renewing itself. As the soil gets depleted, a few things happen at the same time. The existing plants start underperforming. They produce less. They become more vulnerable to stress, drought, heat. And when an old plant finally dies, the seeds in the depleted soil simply cannot germinate properly, because what those seeds need to sprout isn't there anymore. That is type 2 diabetes at the cellular level, not just damaged beta cells in isolation. A metabolic environment so depleted in foundational minerals that the body's natural regeneration cycle can no longer complete itself. The progenitor cells, your reserve cells, the ones waiting to become new beta cells, are present, but the biochemical soil they need to activate and differentiate has been drained. Now here's the part of this analogy that I want you to hold on to, because it's the most important piece. What if you could remineralize that soil? Not a pharmaceutical intervention, not a surgery, just restoring what the garden was always supposed to have. That's not a metaphor for some futuristic treatment. That's a precise description of what specific seed compounds have been shown to do in peer-reviewed clinical research. And it starts with a seed you've probably walked right past 100 times. The primary seed, pumpkin seeds. The cornerstone of this entire protocol is pumpkin seeds, also sold as pepitas, and they may be the most underappreciated food in all of metabolic health for seniors. Here's what makes them extraordinary for diabetes specifically. Zinc delivery. A single 30-gram serving of raw pumpkin seeds, that's about 3 tablespoons, contains roughly 2.2 milligrams of highly bioavailable zinc, more than almost any other plant food you can name. And why does that number matter so profoundly? Because insulin, the hormone your body either can't make enough of or can't use properly, is structurally a zinc protein complex. Inside your beta cells, zinc ions are used to fold insulin molecules into the correct shape, package them into storage granules, and protect them until your blood sugar calls for their release. Without adequate zinc, that entire process breaks down upstream before the insulin even has a chance to be deployed. Magnesium for insulin resistance. Pumpkin seeds are also one of the richest whole food sources of magnesium. A single serving delivers roughly 37% of your daily requirement. Here's why that number is critical for someone managing blood sugar. Your muscle cells require magnesium to activate something called GLUT4 transporters. Think of GLUT4 as a revolving door on the surface of your muscle cells, a door that pulls glucose out of your bloodstream and brings it inside the cell where it can be used for energy. Insulin is supposed to spin that door open. But when magnesium is deficient, which studies confirm affects between 25 and 48% of people with type 2 diabetes, and potentially more in those with poorly controlled blood sugar, that door stays partially jammed. Insulin is present, the signal is sent, but the door doesn't fully open. That's insulin resistance, and it can be partially driven by nothing more complicated than a magnesium deficit that pumpkin seeds can directly address. This is why pumpkin seeds are the foundation. They're not just adding nutrients, they're restoring the exact raw materials your beta cells and your muscle cells need to do their jobs. If pumpkin seeds aren't already in your kitchen, drop a starting today in the comments. I want to know who's taking this seriously. And if this is the kind of information your doctor has never once mentioned to you, hit that like button right now. It helps this channel reach the seniors who need it most. Now, I want to walk you through the 4 specific biological pathways that this morning's seed protocol targets. I know that word pathway sounds clinical, but understanding the mechanism is what separates a protocol you actually stick with from one you abandon in 3 weeks because you don't understand why it should be working. Pathway 1, zinc-mediated insulin synthesis and beta cell regeneration. Your beta cells are zinc-hungry organisms. They concentrate zinc at levels that Stanford researchers have documented as up to 1,000 times greater than surrounding tissue cells. A concentration so extraordinarily high that scientists use it as a method to physically sort and identify beta cells in pancreatic tissue. That's how profoundly these cells depend on zinc, because every stage of insulin production, from reading the insulin gene to assembling the protein to folding it, packaging it, and triggering its release, requires zinc at each step. Research published in the Journal of Nutritional Biochemistry found that supplementing zinc-deficient diabetic subjects with dietary zinc sources produced statistically significant improvements in both fasting glucose and insulin secretion capacity within 8 weeks. Beyond that, zinc has been shown to upregulate transcription factors that support beta cell differentiation, meaning new beta cells forming from progenitor cell reserves. This isn't managing output, it's supporting the regeneration mechanism at the source. Pathway 2, magnesium and GLUT4 transporter activation. Let me be blunt here. GLUT4 dysfunction, the failure of glucose doors to open fully in your muscle cells, is one of the primary drivers of type 2 insulin resistance, and correcting magnesium deficiency is one of the most clinically validated non-pharmaceutical ways to improve it. A 2025 meta-analysis pooling data from 23 randomized controlled trials involving 1,345 participants with type 2 diabetes found that magnesium supplementation significantly reduced fasting blood glucose, and crucially, subgroup analysis showed the greatest improvements in adults aged 65 and older who received supplementation for longer durations. That finding is directly relevant to this audience. For someone in the early to moderate stages of this disease, a clinically meaningful reduction in fasting blood glucose from correcting a simple dietary mineral deficiency is a genuinely important finding. Pathway 3, sesame lignans and liver glucose regulation. This is where our second seed, sesame seeds, enters the picture. And this pathway specifically targets something most diabetes protocols completely skip over: your liver. Here's what many people don't realize. A large portion of your fasting blood glucose, the number you measure first thing in the morning before eating, doesn't come from last night's dinner. It comes from your own liver through a process called hepatic glucose production. When this process becomes dysregulated, which it does in type 2 diabetes, your liver keeps pumping stored glucose into your bloodstream overnight, even during a 10 to 12-hour fast. That's why many diabetics check their morning glucose and find numbers that don't match how carefully they ate the day before. Sesame seeds contain a unique group of compounds called lignans, specifically sesamin and sesamolin, that have been shown to suppress an enzyme called glucose 6-phosphatase. That enzyme is the primary mechanism your liver uses to release stored glucose. By gently dialing down that enzyme's activity, sesame lignans reduce the liver's excess overnight glucose output. That directly lowers fasting blood sugar through a mechanism that is entirely separate from anything else in this protocol. This is not redundancy. This is a different door into the same house. Pathway 4. Sunflower seeds, vitamin E, and post-meal glucose blunting. Sunflower seeds are among the richest plant sources of vitamin E, specifically the alpha-tocopherol form, which has the strongest documented antioxidant effect on beta cell membranes, the cellular walls most vulnerable to oxidative damage from chronic inflammation. But here's their second and equally important contribution: chlorogenic acid. This polyphenol compound inhibits an intestinal enzyme called alpha-glucosidase, the enzyme your small intestine uses to break complex carbohydrates into simple glucose for absorption. When alpha-glucosidase is inhibited, even partially, glucose enters your bloodstream more slowly after meals. That flattens the post-meal glucose spike. Less spiking means less reactive insulin demand, less stress on an already taxed beta cell population, and less long-term cellular fatigue. Interestingly, this is the same mechanism used by a common diabetes medication called acarbose. Sunflower seeds deliver a natural version of that effect without the gastrointestinal side effects that frequently accompany the pharmaceutical. If you're still watching and this helps, type number 4 in the comments. If you haven't subscribed yet, hit that button and the bell so you don't miss any future videos. I want to give you the specific studies behind what I've described because I'm not asking you to take any of this on faith. A 2025 controlled clinical trial published in the Review of Diabetic Studies examined adults with type 2 diabetes who received daily pumpkin seed powder supplementation over 6 months alongside standard care, compared to a control group receiving standard care only. The pumpkin seed group demonstrated a meaningful reduction in HbA1c, a statistically significant decrease in triglycerides, a key driver of metabolic dysfunction, and improvements across multiple lipid markers that were entirely absent in the control group. Separately, a 2025 systematic review published in Nutrition Reviews by Oxford University Press, which analyzed 9 controlled clinical trials involving 316 participants across multiple institutions, concluded that pumpkin and its bioactive compounds showed consistent potential for improving glucose outcomes and metabolic biomarkers in people with or at risk of type 2 diabetes. The researchers specifically noted that the seed's exceptional mineral density, particularly zinc and magnesium, appeared to be central to the mechanism. The foundational point is that these cells had more capacity than they were able to express, and restoring minerals unlocked it. A 2023 systematic review and meta-analysis published in Phytotherapy Research, one of the most comprehensive analyses of sesame and glycemic control to date, pooled data from 8 randomized controlled trials involving 395 participants with type 2 diabetes. Across that pooled data, sesame consumption significantly reduced fasting blood sugar by an average of 28.61 milligrams per deciliter and reduced HbA1c by 0.99 percentage points compared to controls, a clinically meaningful glycemic shift in its own right. Separately, an Iranian randomized clinical trial also documented a significant reduction in hsCRP, a validated marker of systemic inflammation, in participants who consumed sesame daily, suggesting the lignans were doing double duty, improving glycemic markers while simultaneously protecting beta cells from the chronic inflammation that accelerates their loss. At Harvard's T.H. Chan School of Public Health, a landmark long-term analysis following 85,060 women for 18 years found that higher dietary magnesium intake, primarily from whole food sources including seeds and nuts, was associated with a significantly lower risk of developing type 2 diabetes, even after adjusting for body weight, physical activity, and family history. A subsequent meta-analysis published in Diabetes Care, pooling data from 25 prospective cohort studies involving over 637,000 individuals, confirmed that dietary magnesium reduces type 2 diabetes risk by approximately 17% overall, with a clear, statistically significant linear dose-response relationship. And crucially, research has consistently shown that protective effect is most pronounced in adults over 55. That's this audience. That's you. A published randomized double-blind placebo-controlled trial examined the effect of 400 milligrams of chlorogenic acid daily for 12 weeks in patients with impaired glucose tolerance, the pre-diabetic threshold where intervention matters most. Fasting blood glucose was significantly reduced and the insulinogenic index measurably improved, both markers of more efficient insulin secretion. A 2026 comprehensive review in Frontiers in Pharmacology confirmed that human randomized controlled trials consistently show chlorogenic acid supplementation can significantly reduce postprandial blood glucose and HbA1c levels and improve insulin sensitivity, with alpha-glucosidase inhibition identified as a primary mechanism. These are not dramatic single-meal effects. They are consistent daily improvements that compound into measurable A1C change over weeks and months. That's how metabolic recovery actually works. Here is the complete morning protocol. These are specific doses with specific preparation notes matched to the clinical evidence. This is not approximate. Seed 1, pumpkin seeds, 30 grams, approximately 3 tablespoons every morning. Buy them raw, unsalted, and shelled, the ones labeled pepitas. Do not buy roasted or salted varieties. Roasting reduces zinc bioavailability by approximately 25%, and degrades the heat-sensitive fatty acids that contribute to the anti-inflammatory benefit. For seniors who find the texture uncomfortable, soak them in water for 15 minutes before eating. This softens them without reducing nutritional value. Eat them at or before your first meal of the day. One important note, avoid consuming pumpkin seeds at the exact same time as high-calcium foods like dairy milk. Calcium and zinc compete for the same intestinal absorption pathway, and consuming them simultaneously can cut zinc absorption significantly. Space them 30 minutes from high calcium sources. Oat milk, almond milk, or other plant-based milks don't have this issue. Seed 2, sesame seeds, 28 grams, approximately 2 heaping tablespoons every morning. Unlike pumpkin seeds, sesame seeds benefit from light toasting. 30 to 40 seconds in a dry pan over medium heat, just until you can smell them, is sufficient. This cracks the outer hull and meaningfully improves bioavailability of sesamin and sesamolin, the lignin compounds doing the hepatic glucose work. Don't over-toast. You're cracking the hull, not roasting the seed. Excellent ways to use them: stirred into oatmeal, scattered over eggs, blended into a morning smoothie, or as tahini, ground sesame paste. 2 tablespoons of tahini is a practical equivalent, and the grinding process improves lignin bioavailability even further. Seed 3. Sunflower seeds, 28 grams, approximately 3 tablespoons, every morning, raw and unsalted. Sunflower seeds eaten alongside a small amount of healthy fat, avocado, olive oil, a handful of walnuts, significantly improves absorption of their fat-soluble vitamin E. Eat them mid-morning or alongside your pumpkin seeds. The chlorogenic acid works best when it's present in your gut at the start of your highest carbohydrate meal of the day, so timing around breakfast or your biggest morning meal is ideal. Seed 4. Hemp seeds, 15 grams, approximately 1.5 tablespoons, every morning. Hemp seeds deliver something the other 3 don't: gamma-linolenic acid, or GLA, a fatty acid precursor to anti-inflammatory prostaglandins that specifically suppress the chronic low-grade inflammation-driving progressive beta cell loss. The gamma-linolenic acid multicenter trial group, a large multicenter clinical trial involving 111 patients with diabetic complications, found that GLA supplementation at 480 milligrams daily for 1 year produced significant improvements across 16 measured clinical parameters compared to placebo. Mechanistically, published research confirms that GLA directly suppresses NF-kappa B, the master inflammatory signaling pathway most directly tied to accelerated beta cell destruction. By blocking the intracellular cascade that triggers beta cell apoptosis, hemp seeds need zero preparation, no soaking, no toasting. The hull is naturally soft enough for normal digestion. Sprinkle on yogurt, blend into a smoothie, mix into oatmeal. Mild, nutty flavor. Genuinely one of the most convenient additions in this entire protocol. Morning additions. 2 cups of green tea or matcha, brewed at 175 degrees Fahrenheit, not boiling. Boiling water destroys up to 60% of the catechin compounds responsible for EGCG's AMPK activating effect. No dairy milk. Milk proteins bind catechins and block absorption. A squeeze of lemon is fine and actually improves it. A half teaspoon of Ceylon cinnamon, not cassia, in your morning coffee, oatmeal, or smoothie. Ceylon cinnamon contains meaningful cinnamaldehyde, which improves insulin receptor sensitivity. Standard cinnamon at most grocery stores is cassia, which contains high coumarin levels that, at daily doses, create unnecessary liver burden. Check the label. Spend the extra $1. It matters. And if nobody has ever broken this down for you this clearly before, hit subscribe right now. Every week, I bring you the research your doctor doesn't have time to explain, built specifically for you. Don't miss what's coming next. Let me address the 4 mistakes that most commonly prevent people from seeing real results with this kind of protocol. Mistake 1. Buying roasted, salted seeds. I'll say this plainly. The seasoned snack mix seeds in the grocery store snack aisle are not this protocol. Roasting oxidizes fragile fatty acids, reduces mineral bioavailability, and destroys the specific lignin and polyphenol compounds you're trying to consume. And for seniors managing blood pressure, the sodium load in salted seeds is an unnecessary burden on top of everything else. Raw for pumpkin, sunflower, and hemp. Light toasted, specifically only for sesame, for the precise reason I explained. That's the distinction. Mistake 2, expecting results in the first 2 weeks. And I want to be completely transparent here, especially for this audience. The pathways this protocol targets, mineral repletion, beta cell support, GLUT4 sensitization, hepatic glucose regulation, these are not acute effects. They accumulate. The clinical trials showing the most significant outcomes ran for 10 to 16 weeks. Most people who follow this consistently report their first noticeable shift in fasting glucose around weeks 5 to 7. If you check your numbers every 3 days in week 2 and don't see a dramatic change and you quit, and I've watched many people do exactly that, you've abandoned a process that was just getting started. The biology is working before the numbers move. Give it 90 days. Mistake 3, swapping whole seeds for supplement capsules. This is a mistake I see often in older adults who dislike the texture of seeds or find the preparation inconvenient. I understand the appeal of a capsule, but the clinical evidence consistently shows that isolated seed extracts underperform their whole food equivalents. The reason is mechanistic. The fiber, the polyphenols, the mineral matrix, and the bioactive compounds in whole seeds work synergistically. They are not independent actors that produce the same result when you separate them. The fiber in pumpkin seeds improves zinc absorption by slowing digestion. The fat in sunflower seeds carries vitamin E. These interactions don't survive extraction into a capsule. Whole seeds first, supplements as a last resort, not a convenience preference. Mistake 4, treating this as a workaround for an otherwise unchanged diet. These seeds are genuinely powerful biological tools. What they are not is a compensation mechanism for a diet otherwise built on processed foods, refined carbohydrates, and high-sugar beverages. You cannot outseed a diet that is actively working against you at a scale these seeds cannot overcome. This protocol is an accelerant for a broader dietary shift toward whole foods, not a loophole that makes the shift unnecessary. One more thing I want to address specifically for older adults, because it affects how you should think about these doses. After age 65, the digestive system's ability to absorb zinc and magnesium from food sources declines measurably. Stomach acid production decreases with age, a phenomenon called hypochlorhydria, and the intestinal cells responsible for mineral transport become less efficient. This means older adults typically need more dietary zinc and magnesium to achieve the same serum levels as a younger person eating the same meal. The doses in this protocol are not excessive for that reason. They are appropriate for an older adult with absorption challenges, and here is one simple preparation tip that can make a real difference. Before eating your pumpkin seeds in the morning, soak them in water for at least 20 minutes. Seeds contain a compound called phytic acid, also called phytate, that binds to zinc and magnesium and can reduce their absorption by 30 to 40%. Soaking reduces phytic acid content significantly. You're not changing the food, you're just making what's already in it more accessible to your body. That one step, done consistently every morning, can meaningfully improve how much of this protocol your body is actually absorbing and using. Let me bring all of this together for you before you go. Type 2 diabetes is not simply about having too much sugar in your bloodstream. At its root, it is about a pancreas that has been progressively depleted of the minerals and micronutrients it needs to maintain, protect, and regenerate its insulin-producing beta cells. And in the vast majority of cases, that depletion is never directly addressed, only managed around with medication. Pumpkin seeds, 30 grams daily, raw, deliver the zinc and magnesium that are structural components of insulin synthesis and beta cell function. They remineralize the biological soil that your beta cells need to grow and work properly. They are the foundation of this entire protocol. Sesame seeds, 28 grams daily, lightly toasted, target hepatic glucose production through sesamin lignin activity. This is the mechanism responsible for elevated fasting blood sugar that has nothing to do with what you ate the night before, and it's a mechanism almost no dietary protocol directly addresses. Sunflower seeds, 28 grams daily, raw, deliver vitamin E for beta cell membrane protection and chlorogenic acid for post-meal glucose buffering, mimicking the mechanism of a class of pharmaceutical glucose blockers through a natural, well-tolerated whole food. Hemp seeds, 15 grams daily, provide GLA-driven anti-inflammatory action that directly suppresses the chronic inflammation responsible for the progressive, ongoing loss of beta cell function over time.